India's national lockdown in 2020, in response to the COVID-19 crisis, was one of the harshest in the world. Millions of people lost their jobs, and vulnerable groups like marginal farmers, livestock keepers, and especially women had a significant dip in earnings. While the government introduced various formal social protection measures like increased quantity of grains through the public distribution system and cash transfers, the implementation of these measures was scattered and unreliable. Given the possibility that such interventions may be needed again in the future when there's an acute crisis, it's important to understand what determines better access to formal social protection and consequently food security. Newspaper reports suggest that in situations where formal social protection was lacking in its implementation, collective organizations played a crucial role. The research I propose explores a key link that's not yet common in the discussion surrounding One Health governance: social capital. In my proposed research, I examine the interaction between social capital and formal social protection and their collective role in increasing household resilience to food insecurity. I also aim to include a gender lens in my research. Access to social capital is important, particularly for vulnerable women, as it provides the formal and informal networks and groups in which they can gain valuable information, influence, and access to other resources. This study hypothesizes that membership in a group, like a women's collective, for example Seva, or a dairy cooperative, may increase access and utilization of formal social protection and therefore an increase in food security. This study will be operationalized with livestock keeping households in Ahmedabad, a rapidly urbanizing city in Gujarat, India. Data will be collected using an intra-household survey, focus groups, and key informant interviews. The outcomes of this research could be important in filling the gap between community involvement and policy implementation that's currently seen in urban India by making a case for the deliberate inclusion of certain forms of collective organization.